Okay, good evening, guys. For discussion C tonight, we're discussing dementia and things, and when it's necessary for a loved one to get in home care for families uh, for to take some of the burden off of their families. So we're going to discuss that tonight for discussion C. So please join me in tonight's discussion. Give me a minute to set up for the show, and I'll be right with you, please. I have to set my notes up, guys. I'll be right with you. Okay, folks, I'll be right with you. Now, remember I said tonight's show is centered around when it's necessary for someone to get dementia care in home. So, we're going to discuss that now. For tonight's discussion C, please join me in tonight's discussion C. Okay, here we go. Dementia can make everyday life challenging, and recognizing when at home care is necessary is crucial for ensuring safety and well being. Here are some interesting facts related to this topic. Okay, wandering is common. Wandering is a common issue. People with dementia may leave home and struggle to find their way back, even in familiar surroundings. This can be dangerous, especially in extreme weather conditions or high traffic areas. Okay, daily tasks become overwhelming. Simple routines like dressing, brushing teeth, or preparing meals can become difficult. Some individuals may wear the same clothes for days or forget to bathe. Okay, folks? Basically, when somebody has the change in their daily routine that you know them to do at a certain time of day, okay? Let's see. Next page. Give me 2 seconds. Forgetting to turn off appliances like the stove can also pose a serious hazard. Okay, memory lapses impact health. Missing meals, skipping medications, or forgetting to pay bills can lead to malnutrition, health complications, and financial difficulties. Mood swings and aggression. Dementia can cause sudden behavioral changes, including aggression or withdrawal from social activities. Professional caregivers can help manage these symptoms. Social isolation worsens with symptoms. Researchers suggest that staying socially engaged can slow cognitive decline. However, people with dementia may withdraw from friends or family, guys. Caregiver stress is real. Family members providing care often experience emotional and physical exhaustion. Bringing in professional help can ease the burden and improve quality of life for both the individual and their loved ones. Okay. There are several types of at-home care available for dementia patients depending on their needs and their level of assistance required. Here are some common options. Companion services. These caregivers provide supervision, engage in recreational activities, and offer companionship to reduce loneliness and confusion. Personal care services. Personal care assistance with bathing, dressing, toileting, eating, and exercising to help maintain hygiene and daily routines. Homemaker services help with housekeeping, grocery shopping, and meal preparation. To ensure a safe and comfortable living environment. Skilled nursing care. Medical professionals such as nurses or physician or physical therapists provide wound care, injections, and other medical treatments as prescribed by a doctor. Respite care. Temporary relief for family caregivers, allowing them to take breaks while ensuring their loved one receives proper care. Okay, live-in care. Now these folks are ones that come in and live in with you. Okay, they actually live in with clients. A caregiver stays in the home full-time to provide continuous support and supervision. Dementia-specific home care. Specialized caregivers trained in dementia care help manage symptoms, behavioral changes, and safety concerns. Okay. The cost of at-home care for dementia care varies based on the type of services, the level of care required, and the location. Here's a general breakdown. Companion services typically cost around $25 to $35 per hour, depending on the caregiver's experience and location. Personal care services, more specialized assistance, such as help with bathing and dressing, can range from $30 to $40 per hour. Homemaker services, light housekeeping, and meal preparation usually cost $25 to $35 per hour. Okay, then you get into skilled nursing care and medical care provided by licensed professionals is more expensive, averaging around $75 to $100 per hour. Okay, folks. Respite care, temporary relief for families, caregivers varies widely, from $100 to $300 per day, depending on the provider and services included. Live-in care. A full-time caregiver staying in the home can cost $6,000 to $10,000 per month, depending on experience and location. Okay, dementia specific home care. Specialized dementia care may cost $33 per hour on average, with monthly rates averaging from $2,145 for part-time care to $6,292 for full-time care. Assessing quality of care, dementia care, involves several key criteria to ensure the best possible support for individuals with the condition. Here are some important factors to consider, folks. Person-centered care. The caregiver should prioritize the individual's preferences, routines, and dignity, tailoring care to their unique needs. Safety measures. High quality care providers will conduct regular safety screenings for risks such as wandering, falls, and environmental hazards. Medical and behavioral support. Effective dementia care includes screening for behavioral and psychiatric symptoms such as depression and providing appropriate management strategies. Okay, caregiver education and support for families. Okay, caregiver education and support for families and caregivers should receive education on dementia management and access to resources for emotional and practical supports, folks. Financial status assessment. Regular evaluations of the individual's ability to perform daily activities help ensure they receive the right level of assistance. Advanced care planning. Quality care includes discussing about future medical decisions, palliative care, and end of life preferences. Social engagement. Encouraging meaningful activities and interactions can slow cognitive decline and improve overall well being. Okay, here's the question for y'all for tonight. For this one, would you like help finding dementia care providers that meet this criteria? Okay, guys, so that is it for tonight. Maybe I'll jump back on later, but for now, Gator Wellness, take care, folks. Have a good night. If I can, I'll jump back on and do a D for you.